I think Minister Butler and the Prime Minister made it quite clear that they do intend to do a deep inquiry into the national COVID response. They have not yet determined the timing or the nature of that inquiry. Their view was that they would like to see how we settle a little bit in this new, as you say, different phase where COVID is not having quite the impact that it used to have. But I imagine that will be a decision for government in the not too distant future about the timing and nature of that inquiry.
We're still in a pandemic. The WHO continues to meet regularly with member states to look at the global situation, and they've decided that COVID-19 fairly recently in most recent discussions remains a public health threat to the world. There will be more waves into the future. I predict there will be at least another couple this year. We have to learn lessons from this extraordinary time so that we can be more prepared for the future. I think there will be a long tail to this pandemic even once the acute phase is slowing down. We still are reporting on the National Notifiable Diseases Surveillance System data every week rather than daily, so it does have every day's data in there, but it is less liable to those fluctuations that the Secretary has said. So the number is 18,190. That's as at the 8th of February.
Okay. And have you got them broken down into years, so 2020, 2021, 22, and obviously to date this year?
I have the data for 2022 is 14,855.
14,855 for 22.
For 2022.
Yep.
892 so far this year. In residential aged care homes there have been 5,075 deaths during that since the beginning of 2020, and I do have that by year. Yep. 686 in 2020, 226 in 2021, 3,855 in 2022, and 308 up to the 9th of February this year. Death from any cause, of course, is a sad but unfortunately inevitable event. Just very specifically to your comment there about the second half of last year, that figure I gave you was for the full year. The highest death rate was actually in January of last year, not the second half of the year.
So you're saying more people died in the first half of last year, not the second half of last year?
There were 3,855 deaths in aged care related to COVID in 2022. There were, as you know, several waves of Omicron related COVID during the year. The highest rate and the biggest effect on aged care was actually the first one, which was in December of 21, and peaked in January of 22, and then into February.
As best I could extrapolate from the data that was made available, it appeared as if there were 912 people in aged care died in the first part of 2022. And on that basis, that leaves nearly 3,000 that died subsequent to that. So I'm just sort of understanding that, I mean, yes, we certainly knew that the Omicron wave that hit us in January 2022, was, the time when we opened up, and it was a very tragic time. But it seems like, there was a lot of focus on that and a lot of activity. I know you put a lot of effort into trying to deal with that, but it seems like at the end of 2022, I mean, despite the fact the focus on the tragic deaths in the early 2022, there have been massively increased numbers of people who've died in aged care from COVID at the end of 2022. But I don't think I've heard what you're doing to try and deal with that. It almost seems like no one's really taken much notice of the fact that so many people died in aged care at the end of 2022, and no one's really talking about it. No one seems to be placing any urgency or any importance on it.
The reason why there have been more deaths during 2022 has been because we are living with COVID. There is a large number infections that have occurred, millions of infections that have occurred in the community.
When did it first come to the attention of the TGA that 2 Australian children, one aged 7 and one aged 9 years of age, died of cardiac arrests directly after receiving a COVID vaccination?
So, Senator, we have a number of reports of deaths of people of all ages, including children, temporarily related to adverse events from vaccination, or not related to adverse events from vaccination, just related in time. So these these two reports were received in our database of adverse event notifications. Unfortunately, we were unable to get sufficient information on these particular cases to assess them in detail, but they were associated, the information we did have is that they were associated with heart attack, which is not a known adverse event of any of the COVID vaccines.
I'm sorry, did you just say that cardiac arrest is not an associated
adverse event
as
of
event?
COVID
Myocarditis, which leads to heart attacks, is
no,
not...
but the two are different. Myocarditis is an inflammation of the heart muscle.
Sure, I understand that.
Yeah.
Sorry, Senator, please finish your answer, and then Senator Antic, I'll allow your questions to be asked in
Good.
silence.
Thank you for that. So myocarditis is an inflammation of the heart muscle. Pericarditis is inflammation of the lining of the heart, and heart attack is a different clinical entity. Some people with myocarditis do have an increased propensity for heart attack, but they are different from a myocardial infarction.
Sure. So, but at the end of the day, the question was, when did the TGA become aware of the deaths of a 7-year-old and a 9-year-old from cardiac arrest, which in a short time frame from having a COVID vaccination?
I'd have to take on notice the dates that they were reported, those individual cases, to the database of adverse event notifications. As I've said before, we have almost 1,000 reports of deaths temporarily around the same time as COVID vaccination, of which 14 have been determined to be related to COVID vaccination.
These are
So there are probably many more people under 20, 30, whatever age you care to call, that have been reported to us. But these reports do not indicate causality, and quite often they come with very limited information. Sometimes they come with very detailed information. We do try to get more information when we can, but we can't always.
You do have in front of you two notes for file which relate to both of the incidents which have been obtained on freedom of information,
Yep.
both of which I think do draw a conclusion that they were as a result of the COVID vaccination.
No, that is incorrect, Senator. If they are as a result of vaccination, we would have put an announcement. They were not concluded to be associated with the vaccination.
So these were just a 7 and a 9-year-old who just died of... How often do 7 and 9-year-olds die of cardiac arrests?
Unfortunately, it's not as uncommon as you think.
Really?
So, yes. So, in fact, if you look, especially in associated with sporting events, somewhere between 1 and 200 Australians die of what we call sudden cardiac death, under 30, so admittedly they're often people in their teenage and 20s, but sometimes they do go younger. They are rare, but they're not unknown. You have over 100 people, often they're football players on the football field.
So why is it then, or in fact, were the death of these two children relayed to ATAGI at any time thereafter? Because I believe these happened very early on in the vaccine rollout.
It's TGA's responsibility, again using an external vaccine safety investigation group, to determine causality. The external group is when there's questions around the case. So as we've indicated in this place before, there is, in each of these, looked at by 3 separate doctors, including a senior doctor. As you'll see from the redaction, the words MO mean medical officer, and this is someone who's trained and registered in Australia, but reviewed each of these. They were not seen as being associated with vaccination. That is incorrect, Senator.
Can I follow up on Senator Antic, Chair?
He's got 37 seconds left,
He can,
so it's up to Senator Antic.
yes, Senator Roberts.
Freedom of Information request 3727 from Queensland. Dr McCann requested causality assessments for all of the reported deaths in the Dane database, which on negotiation was reduced to 11 documents, of which 10 related to Dane death reports. These documents showed the TGA had assessed as causally linked to COVID vaccines deaths that are not included in the 14 deaths from COVID injections, including the 9-year-old and the 7-year-old.
Senator, the statement you've just made is false. Absolutely false.
It's in a freedom of information request.
Yes, and it's absolutely false. Go and read the Freedom of Information and see what it actually says. We have reported every death that has been associated with these vaccines. Why on earth would we hide a 7 and 9-year-old?
That is the question.
That is the question.
We are not. We have not.
You're sounding very defensive about it, Professor.
No, I'm not very defensive. I actually have the FOI in front of me.
Senators
and we're
and
deliberately
witnesses.
Well, we'll come back
misinterpreting
to
it.
it in a
Okay.
minute. I
The
can
committee
assure you-
suspends. The committee suspends. Broadcasting is off.
The causality page, assessment, causality determination, causality for the 7 and 9-year-old.
Senator, you're misunderstanding basic English here. So causality is...
Senators, I'm about to... The committee suspends. The committee suspends. Resumes. Senator Rennick has the call.
It does say causality here at the bottom of these two statements. Okay, so my question is, okay, so at some point the AEFI assessment team has said causality. Now, the other assessment... Can I just finish my statement?
Sorry, Professor Skerritt. Senator Rennick is entitled to ask his question in silence, and then you will give your answer in silence.
Of the 10 that we've seen, some say awaiting causality and some say it's not causality, right? There's 4 that say, one's got a question mark, but the other 3 say causality. So my question is, why did these particular ones with causality have causality, and then who has overruled that and why?
Senator, causality is a heading. That's why I was trying to explain the way it's used on the form. So you have a decision. And so let's use the example that you've quoted at me, because I have the form in my hand. And it says causality. And then the next dot point under causality is WHO unable to be determined, unclassifiable, because of lack of information. So causality is the heading, Senator. It is not the conclusion.
It actually says decision, causality.
It says decision, dot point 1, and I can table this with the chair. I have the document in front of me. Decisions, dot point 1, causality, then WHO, unclassifiable, unable to be determined. That's what it says in black and white.
Okay, you previously described cardiac arrest as a heart attack. They're 2 separate things. Do you know the difference between a cardiac arrest and a heart attack?
Look, there's a range of different conditions.
Yeah,
Sorry, Senator Rennick. Professor Skerritt.
Yes, so thank you. So this was a cardiac arrest, but it is not. It was not determined with the information given to be related to a vaccination, as I've said again. And so what I feel is absolutely wrong that you're saying is that somehow this form said that it was causally, 2 L's, causally related. The form did not say that, I swear on my mother's grave, right?
Okay. You've got your point across.
Thank you.
So you just said myocarditis doesn't lead to heart attacks. Does myocarditis lead to cardiac arrest?
There are cases where people who have had myocarditis have an increased prevalence of a range of other cardiac conditions, but to say it leads to cardiac arrest is misleading, especially given that most myocarditis associated with vaccination, and indeed there's a recent publication from in a top medical journal by Nordic scientists, is much milder than myocarditis after COVID infection or other forms of viral myocarditis.
I'll dispute that, but that's not what I'll dispute right now. My next question is, there's a 21-year-old female who died from the Moderna vaccine. She had an antiphospholipid syndrome, which is an autoimmune disease. Now, the vaccine was never tested on people with autoimmune diseases. Why haven't you put a warning label on the actual vaccine to warn people that if they have an antiphospholipid syndrome, which is 1 in 2,000 people, higher than the rate of multi-inflammatory disease that you've said 1 in 3,000, why haven't you put a warning label on the vaccine to warn people about that?
Senator, again, I've got to pick you up on your science. First of all, antiphospholipid syndrome is actually even a bit more common than that. It might be 1% of people. So it's a considerably common condition. And because it was a common condition, early in the rollout of the vaccines, it was indeed studied whether people with antiphospholipid syndrome had an increased risk after vaccination. And there were international studies carried out, published in the world's top medical journals. A study using Italian patients, a study using Turkish patients, and I believe the third study was done in British patients. And let me just quote from one of them. The COVID vaccine does not increase the risk of thrombolytic events among patients with antiphospholipid syndromes, according to study results published in Rheumatology. Rheumatology is a top journal which would cover people with antiphospholipid syndromes. I then go to the patient group. There's actually a patient support group in the UK for people who have antiphospholipid syndrome. And I will read from their web advice to patients. There is no evidence to suggest that patients with antiphospholipid syndrome were at increased risk of complications from the available COVID vaccines.
Okay, thank you. So you said in a press conference that Moderna would provide 100% protection from death. Well, in this particular case, it didn't.
Senator,
you said it would provide... I haven't
that.
finished my question. Don't interrupt.
Well,
you said it would provide...
Excuse me.
Sorry.
Senator Rennick is entitled to ask his question in silence. Professor Skerritt, I will give you an opportunity to respond in full. Senator
You said it would provide protection from infection for 93% of the people for up to 6 months. You were wrong. Will you retract that statement?
No, Senator, I will not retract that statement because at the time, once again, you've quoted me out of context, and I would suggest deliberately, Senator. If you go back to the record of that press conference, Senator, it was quoting the clinical trial results as published in the New England Journal of Medicine as I stood up with your former colleague, Minister Hunt. And when I stated that, I stated, here are the results from the New England Journal of Medicine from a clinical trial that showed 100% protection against death in that clinical trial. So I stand by that statement because that paper stands in the New England Journal of Medicine, which is one of the world's top 3 medical journals. So I stand by that statement. But you have somehow reworded it, Senator.
Excuse me.
I'm quoting your own words.
Senators, Senator Antic on a point of order.
I want to raise a point of order. The Professor has clearly impugned Senator Rennick's motives for this from saying he deliberately misquoted something or misled him.
Well, I think that's fact.
Sorry, point of order for you as well, Minister.
To raise awareness of the
Senators,
risks of the Moderna
Senators,
vaccine.
Senator Rennick,
You
Senator
are
Rennick.
projecting misinformation
I'm not,
and then challenging it when it's met with factual answers. That's what's going on here.
This is on the
Make
record.
no mistake, we're all aware of what's going on. The evidence and facts doesn't suit your narrative. It doesn't suit your narrative. I've been watching you.
Senators,
I've been watching you scoff. I've been watching you roll your eyes.
Senators and
This is going to turn very nasty.
Senators and Minister, I will suspend the committee again if I cannot bring the committee to order. This will take a very long time if every few minutes I have to suspend. The committee suspends. Broadcasting can be turned off, please.
Professor Skerritt, the discussion that was involving Senators Antic, Rennick and myself, could you resolve that, please, by giving us an unredacted copy of the document in front of you that you were reading from?
Senator, I believe that we cannot, for reasons of personal privacy. I understand that this issue has been to the Administrative Appeals Tribunal, and the Administrative Appeals Tribunal also confirmed that the documentation released was appropriate. So we take personal privacy very seriously, and also there are specific requirements within the legislation, within the Freedom of Information Act, that for example, you don't put on a disclosure log information that could prejudice personal privacy. So we follow the requirements of the FOI Act.
Okay, let's move on then. All-cause mortality should go down after a supposed pandemic, not backfire and go up alarmingly after mass indiscriminate vaccination. What happened? Why?
So that has been looked at closely, mortality statistics within Australia, including by the professional group, the Australian Society of Actuaries. And they've attributed the increase, I think it's a 13% increase, but Professor Kelly may have the exact figure in his head. 16, thank you.
That's up to the 30th of September.
Yes, so that figure has been looked at closely by the actuaries, and they ascertain about half of it to COVID-related effects, COVID infection-related effects. They ascertain the rest to other effects such as I think was said earlier this morning, cardiac disease, perhaps oncology, if people, during the peak of a pandemic didn't go to their GPs early enough for a possible bump and it's turned out to be a stage 4 cancer and therefore unfortunately led to death. If you don't have access to those statements from the Actuary Society, we're happy to provide them on notice. Now,
Yes, please.
actuaries are the professionals who work out likelihood and probability and causality for things like deaths, and so they have closely looked at these figures.
I want to come back to this issue of the 7 and 9-year-old children, Australian children, that died of cardiac arrests following injection with a COVID-19 vaccination. And I want to compare that example to the example of the 10th of June 2021 when the TGA convened an expert external vaccine safety investigation group with representatives to review 2 fatalities that occurred shortly after the immunisation of the AstraZeneca vaccine. Is the TGA, through you, trying to tell me that a group of TGA doctors sat in a room with a report of 2 Australian children aged 7 and 9 dying from cardiac arrest following injections, and the TGA did not feel any obligation to inform the public?
We attempted to get additional information. As I said, we have many reports which are very scant in their information. We do not feel that it's appropriate to inform the public when we have a report with a condition that nowhere else in the world. And you've got to step back and realise that there's been, in messenger RNA vaccinations, about 9 billion of these vaccinations given worldwide, including in Europe, including the US, and countries that have very good safety monitoring systems. And we're nowhere in the world, out of almost 10 billion messenger RNA vaccinations doses, have you seen cardiac arrest as a result of vaccination. And when we were unable to obtain further information on these particular cases, we would have felt it would have been alarmist and misleading to go and say, yes, look, there's children dying from this, because the evidence wasn't there to back that up.
And would have undermined the public confidence and reduced the willingness of people to... Indeed. So is it your position, therefore, that these vaccinations are still safe and effective?
Yes.
How many injections have you had, Professor?
I have had 4. I'll answer that personally.
Well,
I've had 4, and I will have a 5th soon.
Would you be prepared
I've not had COVID infection.
Would you be prepared to disclose your immunity register records?
I'm happy to. I've had both the AstraZeneca vaccine and I've had the Moderna vaccine, Senator. But,
and Professor Kelly?
I don't know what else.
Can I ask the same question of you?
I'm just electing to share that.
Senator, I think that's private medical
So
information.
Professor Kelly,
I'm not going to answer it.
There's a very wide scope for estimates in that you can ask questions which go to government expenditure
well, hang on a second.
or the administration of departments. But
Well, I'm more concerned for you, but
community responsibility
with the vaccine.
My vaccination is about keeping other people safe.
Well, I'm very
That's the
concerned that the
whole
minister at the table doesn't understand the science
thank
behind
you,
it.
Minister. Senators,
Very clearly that
Senators, I will suspend the committee again if I cannot call you to order. The committee suspends. Broadcasting will be turned off. Everyone take a deep breath. Could you please find a way to redirect your question in a way which complies with the standing orders? Senator Antic.
Thank you. Professor Kelly, as an employee of the Commonwealth of Australia, would you be prepared to disclose your immunity register to prove how many vaccinations you've had?
It's private medical information, Senator.
Which Australians have been required?
I can absolutely disclose that I'm fully up to date.
With
COVID-19 vaccinations.
Which is how many?
Senator Antic, I thought I was quite clear that the scope of estimates allows us to go to questions which consider government expenditure, the operation of government agencies. It is a very wide scope, but it does not actually go to the medical history of individual witnesses at the table. Please rephrase your question in a way which complies with the standing orders, or please could we move on to a different topic?
Thank you. Professor Murphy, would you be willing to disclose your...
Out of order.
I'm not... This is not a question directed to you, Minister.
Senator Antic.
I'm the minister at the table.
Senator
The
Antic.
minister at the table would be aware of the fact that transmission is not affected by vaccination.
Senators,
that is a concern.
the committee suspends and broadcasting will be turned off. Could we please have a private meeting, senators?
As I've explained before in this place, the spike protein, first of all, isn't a freely circulating protein in significant amounts. It's a transmembrane protein. It anchors itself into the membrane.
That's not what the paper said. The TGA paper said...
Sorry,
it can be
I'm just telling you a
secreted.
scientific fact.
It's in your own documents, page 9, 2389-6, the Pfizer non-clinical report, page 8, top paragraph, said it attaches to the endoplasmic reticulum. It can either be secreted
he should
from
be
the
allowed
cell.
Can I finish?
Question he's going
I can categorically say that the spike protein has a transmembrane anchor region that makes the protein attached to the cell membrane. You're talking about the stages of messenger RNA. You're confusing messenger RNA and protein. They are different. One is a nucleic acid, one is a protein. We are now talking about the protein. There are small amounts of protein.
It says S antigen protein.
So let me finish. And if you need to on notice, I can send you another 10
No,
scientific
you'll not
papers.
lie again, but anyway.
Okay, I'll send you another 20. So there are only vanishingly small amounts of spike protein, and the studies that have gone looking at them show that in most individuals they disappear within a couple of days, hence the 3-day thing. There may be a tiny picogram amounts in a few people for a few days after, but so what?
So what causes the myocarditis in children then if it's not the spike protein?
It's not the spike protein.
Well, what is it then? Is it the lipids?
It is thought to be an autoimmune response, largely dominated by the cellular immune system.
So what triggers that autoimmune response in the children's hearts?
It is still unclear, but it is not the spike protein per se floating around. So it is total pseudoscience to suggest that if you're vaccinated somehow or you receive a blood transfusion from someone who had been vaccinated a week earlier, that you're at a higher risk of myocarditis.
I'm asking for caution.
Sorry, let me finish, Senator. Why on earth would any blood service in the world who have been exceptionally cautious, as we heard earlier today, around things like viruses from people who have a very low risk of HIV/AIDS, why would blood services globally allow
Because in the 1980s...
Senator, let me finish my
Sorry,
sentence.
senators and witnesses, this is not helpful when it descends into a debate
I'm
across
just trying to answer a scientific question.
I appreciate that, Senator Rennick and Professor Skerritt. You both are actually entitled to ask questions and give answers. It just works better if you do it not at the same time. We do have a number of agencies to get through. Senator Rennick, I know some of them are... No, Senator Rennick, I'm still talking. We have a number of agencies to get through. I know some of them are agencies you've requested, so I'd like to move to them quickly.
Okay, that's fine. Okay, so in the 1980s...
After Professor Skerritt finishes his answer,
Very briefly, blood services worldwide have determined that the vanishingly small amounts of spike protein, 3 days, some of them might have 7, some of them might have 2, but a few days after vaccination... Sorry, Senator, I thought I was able to finish my sentence.
Yes.
But it does not pose a risk, including an increased myocarditis. Thank you, Chair.
Under Section 30C of the Therapeutics Good Act, the Secretary of the Commonwealth Department of Health must seek advice from the Office of Gene Technology Regulator on the safety and efficiency of any product which uses GMO as defined by the Gene Technology Act. Do you have any evidence where the Secretary has written to you asking for advice on the safety and efficacy of the COVID-19 vaccines?
Thank you for your question, Senator. Dr. Rajbula, Gene Technology Regulator. Rajbula, Gene Technology Regulator. Where the particular vaccine involves a GMO, there's reciprocal arrangement, if you like, for OGTR to seek advice from the TGA in terms of a risk assessment around that GM vaccine and vice versa. So the TGA may also request advice from the OGTR. And
have you got documentation of that?
For GM vaccines, yes.
Where they've written to you for Pfizer?
No, because the mRNA vaccines were not regulated. They're not required to be regulated through the OGTR.
Did they write to you and actually ask you that question?
No, because they're not required to be regulated through the OGTR.
But how would they know? Because you're the expert. And by the way, gene technology involves both replication and transcription.
Yes.
Yeah, which is what the mRNA vaccine does.
The mRNA COVID-19 vaccines did not involve any step of genetic modification.
They produce proteins.
GMO,
sorry, Senator Rennick, could we just allow Dr. Buller to finish her answer,
or
please?
GMO, which meant that didn't require regulatory oversight by the OGTR.
Yeah, okay. Well, I dispute that. Look up gene technology. But anyway, thank you.
Senator Rennick, is that your last question?
Yeah,
are we happy to dismiss that agency?
I think the witness, I just don't think we need to patronise witnesses in that way.
About gene technology.
Senator Rennick, to tell the Office of the Gene Technology Regulator to look up gene technology is patronising and disrespectful.
I would remind all senators.
Anyway,
Replication.
I just think it reflects
and
poorly on the
transcription.
Senate.
Okay, thank you, Dr. Buller, for your attendance today. We appreciate it.
Professor Skerritt, on notice, could you give me the titles? I won't ask for the names of the people on your committee that reviews doctors' reports attributing deaths to COVID vaccines. And I want their qualifications and whether or not they're registered doctors, please. Albacidin. Recent papers on albacidin confirm earlier hope it can take over from conventional antibiotics. One recent paper showed albacidin would not have the problem of antimicrobial resistance. That is a major issue worldwide. Is there anything happening at the TGA on albacidin? Are you monitoring the science at least?
Thank you for your question, Senator. We are certainly very closely monitoring the science. In fact, I'm keynote speaker next Thursday at the Australian Antimicrobials Congress, which is held every 3 or 4 years in recognition of the importance of regulatory issues and monitoring the science. We haven't had a submission relating to that product because it's still very early days, but we are monitoring. We have guidance to manage antimicrobial resistance because, as you've indicated, it's a serious threat.
Thank you. On 2GB Radio, 16th of March 2021, you said there is no evidence of cause and effect between the AstraZeneca vaccines and thrombosis. That turned out to be false, didn't it? There is cause and effect between AstraZeneca and thrombosis.
Well, if I said that on the 16th of March 2021, and I'd have to see the transcript, it was before I'd confirm whether or not I said that.
Yep.
The evidence developed very much on the days, including Easter, because many of us, or I think 3 of us sitting at this table, didn't have an Easter in 2021. They were, everyone talks a cliche of 18-hour days, but I think for the 3 of us and many of our other colleagues, they were.
Were you fit then to go on and make the comments?
Well, first of all, I want to check the date of that statement and what the wording of a statement has, because I have expressed concerns that statements are not always accurately reflected, so I'd like to see that statement. I think the view was that as of early mid-March 2021 there wasn't evidence, and the other thing we need to clarify is thrombosis with thrombocytopenia is a separate condition from potential impacts of medicines and vaccines on thrombosis alone or thrombocytopenia alone. The TTS syndrome, which really was first identified in the last week of March 2021 and was therefore was the area of intensive work over Easter and the months that followed, can't be very unique, is an almost unique condition.
One of the things that's really annoying a lot of people, especially the vaccine relatives of those killed by the vaccines and the vaccine injured, is that there's been no acknowledgement from the federal government or yourself that these injuries are occurring. There's been no empathy for the pain. There's just no, this is the best stuff in the world. The injections were not even tested properly in the United States. And
Senator
yet
Roberts, if you
them.
could pose it as a question, please.
The question is, when will you apologise to the people who've been brutally injured by these vaccines? Lives destroyed.
Sorry, Senator, I have actually apologised on national television, together with former Minister Hunt, when the first sad death of a lady in the Central Coast. We apologise in writing in our weekly and now fortnightly vaccine safety reports. So we put out detailed public reports, as well as doing media, detailed public reports on vaccine safety. And in that we acknowledge the pain and distress of those who have been seriously injured. But we also emphasise the extreme rarity of these conditions. The same could be said for any medicine. There are other medicines that have many more deaths and injuries associated with them than COVID vaccines, for example, or higher rates of injury. So any death or any adverse event is very unfortunate, and we extend our condolences. But unless if you want to live in a cave or under a rock in a world without any medicines or vaccines, go back 300 or 400 or 500 years.
No, that's not what we want to
we
do.
have modern medicines, and every medicine has risk as well as benefits. By way of indication, since the beginning of the COVID pandemic, more than 10 times as many people have died from paracetamol, from Panadol, than from adverse events due to COVID vaccines.
After you've touched...
Thank you,
And yet we're not
Professor.
banning paracetamol.
Thank you, Professor Skerritt.
Referencing a preprint paper from the British Medical Journal dated 9th of February 2023 titled Age-Specific Severity of SARS-CoV-2 in the Netherlands, produced by the Netherlands Ministry of Health. I don't expect you to have read this paper yet, but we can discuss the issue the paper raises. Their conclusion was that in the Netherlands, the risk of hospitalisation from COVID itself grew exponentially across each age group, and this held true across all 3 major COVID outbreaks in the Netherlands. Children under 10 had a hospitalisation rate of 0.37%, with 0 progressing to ICU or death. That means 99.63% of kids getting COVID did not need a hospital visit once infected. This risk grew exponentially across the age groups to 5.1% above 70.
Is there a question?
Yes, there is a question.
Okay.
Could you summarise, Minister? Sorry, I'm going to summarise. Pfizer product does not stop transmission. Kids have a tiny risk of hospitalisation and a 0 risk of serious harm from COVID. 2 kids we know of have died from Pfizer vaccine on your own assessment. So why are we giving this bloody thing to kill children?
Well, most of the statements you just made then are wrong, in fact, if not all of them, probably, Senator. So first of all, there are impacts on transmission. The impact on transmission of Omicron is much lower than the impact of transmission on Delta and so forth.
For how long?
Senator, we have provided that information on notice. We can provide it again. Secondly, we do not agree that 2 children have died. And thirdly, there have been examples of Australian children in intensive care following COVID infection. And again, we can provide you with that information that comes from departments such as New South Wales Health.